Welcome to Tech Leaders Today with your host, Cassie Crossley. All comments, views, and opinions expressed on this show are strictly those of the host, guests, and callers. Now here's Cassie Crossley.
Welcome to Tech Leaders Today. I'm here with Dr. Stephen LeBoeuf. He's the co-founder and president of Valencell. He has developed ongoing strategic partnerships between Valencell and leaders in industry and academia. He has raised more than $10 million in funding for Valencell and is the inventor/co-inventor of more than 50 granted patents, including dozens of foundational patents in the field of accurate wearable sensors. Welcome, Dr. LeBoeuf.
Hello, good to speak with you.
Thank you for joining me today. I am very interested in the topic of wearables. They have been sort of in the news over the last few years, and I think that whether it be the onset of people first getting watches or even long before them when they really didn't realize that they were wearable tech, all the way back to probably Casio calculator watches. I wanted to find out first about the industry itself and how you find people to work in this space. I know you're in the Raleigh area, but how do you approach that marketplace for wearable tech, which is essentially a new area for technology?
You know, wearables are kind of weird as far as the marketplace goes because it is very different. You know, a smartphone, for example, is something you might have on your person every once in a while. You might lay it on the table. It doesn't need to look pretty for you. You may or may not decide to have an accessorizing case. It doesn't matter too much because it doesn't say much about you, about which smartphone you have. When you wear something, it's so personalized. People, when they put stuff on their body and wear it, the brand is important, how it looks is important, what it says about them is important. Everybody. No one is exempt from that. Even people who feel that they might wear something and they say, I don't care too much about what I wear, and they maybe wear things at a lower cost, they're saying something about themselves and they know it. And so wearables are just different. So one of the things about wearables is you have the confluence of a number of different disciplines that become important. You know, in biometric wearables, which is what Valencell focuses on, wearables that measure your heart rate and respiration rate and provide fitness and health feedback, you have to be concerned about a number of things. One of them is, are you sensing accurately? The technical expertise associated with knowing that you're accurately measuring these biometric parameters is really important. So biomedical engineering, mechanical engineering, electrical engineering, and these types of areas, and also exercise physiology and clinical validation expertise. But then there's also the aspect of being able to work in a bunch of different devices and form factors that people enjoy wearing. And so then you have the mechanical engineering side to make sure that the devices can be small, fit in a number of things like small wristwatches, earbuds, armbands, clothing, and all these things so that people can wear whatever brand they want and still have it be biometric. And these expertise are a lot different than people were used to before. I mean, before wearables, you might have folks, electrical engineers, mechanical engineers to design maybe a boxy thing like a smartphone or a computer, whatever the case would be. But the importance of being able to be aesthetic and small enough and have the technical aspects good enough to where the technology can actually fit in things people enjoy to wear, that wasn't needed when people were putting things on their desk or their tables. So Valencell brings on a team and builds teams that are very multidisciplinary, all the way from the hard engineering aspects such as electrical and biomedical engineering, all the way up to the softer side such as the consumer aesthetic and architectural aspects of mechanical engineering from that aspect, and also the user experience side. How do you use that data and how do you make that interesting on a software application?
I find that having gone into the technical field, I was on the computer science, but most of my peers were mechanical engineers or electrical engineers. Back then, there wasn't a overlap. Do you see in the industry that they have the skills that you need coming out of university level, or does it take a number of years to build up that breadth of experience?
When we started off in the company, we really did need people who had a breadth of experience. And the reason is because in a place like wearables, where you needed people who understood how to work with extended teams of multidisciplinary scientists and engineers, that was something that didn't come right out of college. But now that we've developed our core team, we found we've been much more effective at integrating interns and fresh out of college folks into our company in a way where they can be productive very quickly because we have that infrastructure in place. We can help teach them things they need to learn rapidly as far as interacting with other professionals to get the job done. Whereas, before, bringing those folks right out of college with our small foundational team would have been very hard to do. So it's more about the fact that now we've built a good backbone where we can bring people up to speed quickly to be very productive for both the company and their careers.
How do you attract or retain those skill sets that you're needing right now?
There are some interesting things here for folks to think about in this respect. One of the things that's very important for our company, and it looks like it may be more of a trend nationally and not just with the case of biometric wearables, but broadly, is a lot of people coming into the workforce, especially younger people, are interested in the impact of what they're doing on the world. It's not so much about, okay, how am I compensated and how much money can I make over the next few years? A big part of it is about what impact can they make, which ultimately will be better for the rest of the world as they see it, and also good for their careers longer term. So it's more of a longer term view and more of an abstract value than, maybe in the 80s when it was all about what kind of buck can I make. And so this is one of the things that's inherently interesting about Valencell in this respect is everything we do has a huge impact. Before Valencell, we started in 2006, before there was any iPhone, any Fitbit device, anything like that out there. And we were ahead of the game, telling the world what was going to happen. The purpose of the company when we founded was to make healthy lifestyles easier, more effective, and more affordable through this seamless wearable technology that has made the world healthier. And we know the things we've already done are already going to have a tremendous impact on public health. Well, we've got a whole new line of technology that's going to even have more of an impact. So that helps keep people in place. But also in the company, we like everyone to own part of the company. So we provide stock options to our employees so that they can participate in the value generation of the company as a whole. And that also helps us with retaining folks in the company.
The field that you're in changes so rapidly. How are you keeping all of your talent up to date on the latest?
Well, one of the things is Valencell as a company, where we almost, I want to say about more than 90% of our employees. Now, this is a company, we have sales, we have business development, we have marketing, we have engineering, we have science, accounting. But more than 90% of our employees have a technical background. These folks are not only developing new technology for us, but they are themselves taking the initiative to see what is coming and what's coming down the pipeline. And so we foster this environment of not drinking our own Kool-Aid. What are the things out there to drink our milkshake? And what do we have to do to make sure that we're ahead of the game? And so it's a cultural aspect. It's not one single person, but the culture of the company is one of fierce and fearless innovation.
With the wearable tech industry expanding, are you finding it very competitive marketplace when you're searching for talent or, in retaining your own talent?
This is also a question that has many parts to the answer in, because one thing is there are a lot of companies now trying to recruit the types of people that we educate at Valencell into our employees. And so people want people who have this multidisciplinary talent of understanding not only how to make sensors work very accurately, but how to make them wearable and how to make sure that they're validated. And this is a talent set that is not easy to come by. It's still a relatively early stage market because, I think it's something like only 1 in 5 Americans that own an activity tracker. So it's still far from a mass consumer market so far. But the thing about it is that though that makes things competitive for us, it's true. In North Carolina, Valencell is probably the most widely known and leader in the biometric wearables side. So when companies in the East think about who to work for in wearables, Valencell is there at the top. So we are really good at attracting employees because we have the great separation between East and West. And a lot of folks just want to live in North Carolina. They want to live on the East side. They don't want to go to the West side. And if you're looking now restricted to the East side, Valencell is probably the shiniest star for you. So that helps us out. So it is a competitive marketplace. We have a unique culture that frankly brings in people from the West too. I mean, if you look at our company, I want to say offhand, just thinking out in my mind here, about 15 to 20% of them came from the West to move out to the East because of us and what we did. So we have a unique company culture, but also it helps to be on the East Coast because, it's true that the West Coast has a bigger economy than we have in North Carolina. But it's kind of nice to be different. We have things to offer that other people can't. we're kind of niche-y in that way, and it helps us.
Let's take it to technology. I'm very excited to hear about what initiatives or areas today.
On the technology side, Valencell is always been at the forefront. We've always had. If you look at some of our foundational patents, in some of the filings that we've done more recently in inventions, you see we've invented the future 5 to 10 years away from now even. So we are really planning for this growth of wearables in not just now and immediately now, but also in the future. What you're going to see in the next few years is some interesting things from Valencell and our ecosystem. One of them is a lot more products in the ear. The forecast for hearables, or wearables that are smart wearables worn at the ear, those products are growing by multiples. I mean, multiple. For example, I think next year the marketplace will be 5 to 8 times higher in volume than it was this past year for hearables that have biometrics in them. Earbuds that people wear when they go to exercise, and audio earpieces that now have biometrics in them. You'd be looking to that, and people like this because it's people already exercise listening to headphones, and it turns out you get much more accurate readings at the ear than you do in a part of your body that's moving around a lot, where you have a tremendous amount of motion artifacts. Another thing to be looking for is use cases. When Valencell started developing its technology, we started working with the community to help develop use cases that use that sensor technology. And now there's more and more interesting use cases that weren't there before. For example, if you exercise with a product that has our technology in it, you can learn from the exercise not only your heart rate and heart rate zones, but is your fitness improving or not, in terms of the clinical term called VO2 max. We can provide that to you now with these devices. So as you're exercising, we can give you a true objective measurement of how your fitness is improving. We can tell you if you're ready to exercise the next day, or if you're too fatigued and that you should take a day off. We can tell you that now with this technology. We can tell you if the exercise you've done has helped you with your fitness, or if it's just maintained your fitness, if it's improved your fitness, maintained it, or not helped you at all with it. We can do these things now. All these new use cases are now built into these devices. We can monitor your fatigue, your stress, and help you with ideas uniquely to you on how to improve on those areas for you, whether it's a fitness training aspect or simply some lifestyle aspect of wanting to keep your stress down and be able to perform your best. You'll see a lot of this coming in the next few years. On the medical side, we've developed a technology that works in our ear technology products and also our finger technology products that will assess your blood pressure. So, for example, what we want to do is provide this to the mobile community, where on your smartphone, you could place your finger on the sensor in the smartphone, and in 30 seconds, you'll get a systolic and diastolic estimate of your blood pressure. And we want to go through the full process of getting this FDA approved. Also in the earpieces as well. Right now, that technology doesn't work on the wrist because, as I mentioned before, the wrist is one of the least accurate places in the body to measure these types of biometrics, mostly because of motion artifacts and also something called low blood perfusion, which is a problem for the wrist. But on the ear and finger products that are powered by our technology, you're going to start to see this come in the marketplace in the next couple to 3 years. A roadmap of these new metrics and new user experiences, and also you'll see more in the ear form factors in the coming years coming up.
With all the data that you're collecting, can you talk about that aspect? Because if you're collecting all this biometric data, you talked about how you can analyze it. What are you working on and developing in relation to that?
There's a couple things here. One, we work with our ecosystem where we have various partners who are experts at when you have the accurate data that Valencell provides, what do you do with it? So how do you use that to give someone an assessment? For example, how do you use that data to generate an assessment of atrial fib? So, for example, imagine a situation now where, let's say it's a wrist product, and you're using a wrist product by one of our partners with our technology in it. And as you're living by your day, you're not even thinking about it, but it's sampling your blood flow. And maybe in a week's time, it makes an assessment as to whether or not you have atrial fib or not. And that could be very important. I mean, not can it be? If you know that, that's critically important for the rest of your health moving down the road. And so providing those types of assessments, we've been working with experts who know how to generate those assessments once they have the accurate data we provide. So that's one area. Another area is in developing analytics that can be used in order to use this data in interesting ways. And I'll tell you what I mean. We've done an exploration. As I mentioned, the team is very technically adept with a very strong multidisciplinary nature. Well, we've gone out in the literature and we've looked for all the research that's been done on taking heart rate data, respiration rate data, also something called RR interval, which is the time between heartbeats, and also activity data, motion data. What's been done where researchers have been able to take that data and generate clinically valid outcomes for people. And we said, okay, now this is all public information. It's all in the public domain. Now can we code this up and make this available to people? So we've done this. For example, there's a score that's known by the American Heart Association called the TRIMP score. And that score, what it does is it tells you whether or not you're getting the right dosage in a day of your exercise. In other words, have you moved your heart rate zone enough time and enough duration during a day in order to maintain or improve your fitness? We didn't invent the score. This is American Heart Association. They've shown it. They've done the validation work. But the problem was there were no wearable devices other than chest straps, which no one wants to wear on a regular basis, that could accurately measure that kind of information. And now with our technology, you can measure it accurately in wrist devices, arm devices, clothing, earbuds. And because of that now, these are things that people wear on a more routine basis. We can provide this as people live their everyday lives. The two ways we work with folks is one in the ecosystem with partners who are developing these new analytics, and then two is taking public domain information that's out there in the marketplace today and coding that up to be analytics we provide our partners. So if you're a partner licensing from Valencell or using our technology in your products, our sensor systems, for example, you also get access to these analytics that can provide these assessments.
The technology moves so fast. How do you keep up with, for example, updates or anything like that? Because I know that, in fact, I had tossed away my heart strap monitor that I found from 5 years ago in my closet. So how do you keep up to date as the sensor technologies improve pretty much every few months?
We at Valencell, we focus on a core technology that we call active signal characterization. So what we do is we shine light in the body and we see how it reflects, but most of that signal is noise. We've learned how to characterize that noise and actively remove it. So that's our foundational technology that helps us measure a number of things using light coming back from the body. What we do, and the way we keep ourselves continually relevant, is building upon that. And once you've found the foundational technology that has room to grow around it, you're not so concerned about that technology going away or becoming a dinosaur, because you can keep building around it. And we've been continually able to do that without having to scrap and go to ground zero. As a matter of fact, the blood pressure technology that I told you about that's coming out is based around our core technology that we founded back in 2006.
Are there any risks for security reasons on any of the devices that you have? Do you have to have a whole area in regards to security?
Right now, it's not an issue with any of the partners we're dealing with, because none of them are HIPAA-regulated partners in the consumer space. They're all simply consumer products, and they all have certain agreements with the consumers about what they're going to do with the data. And most of them, it's all up to our partners what they want to do with that data, because it's their devices. But what most of our partners do is tell the end users that their data won't be sent to anyone for any commercial purposes. It'll only be used to help them improve their products. And that's what Valencell's stance has been. We don't commercialize the data we collect from people. When we do R&D, we simply use that to improve our R&D. And so even though folks in this field aren't bound by HIPAA rules or anything like that, the fact is that they do have to provide some kind of data security for the end users. I haven't heard of any situation to date, and Wearable's been around now for quite a bit, where people have had the data abused by any entity. The biggest thing I've ever heard anyone get concerned about is if you're wearing a wearable device measuring biometric information, and if you're wearing a wearable device where this biometric information is being collected, is it possible that somehow an insurance company gets access to this information and then decides what your rate should be off it? And I don't think that's anything people should fear, because there's laws already in the books to prevent that. And so I think that those things are not things people should be too concerned about, at least at this point. And one of the things that also should be mentioned is the way the data is collected. It's always stored in a way where the information about the person is broken away from identifiable information about the person. Even if someone took the data from some of these databases, they have a really hard time figuring out where the data came from.
It's just an anonymous data set.
Right. what we see is that folks have placed their databases where the information about the person is separated from the data side where there's some marker for that person in their biometric data.
That's excellent. What is the best way for people to learn more about Valencell? Because I think the wearable technologies and the biosensor work that you're doing it's amazing.
Thank you for that. And I got to say that the best way to get more information about Valencell, and frankly, all the technologies that are wearable now in the marketplace today, is going to our website, which is valencell.com. Just the company's name, Valencell, which is VALENCELL.com. And if you go to our website, we're on LinkedIn, we're on Twitter, we're on Facebook, of course. You could just type us in Google and the website will pop up. But there we talk about not only our technology, but we talk about the marketplace. We have a blog talking about where the market's going, what kind of devices are coming to the marketplace, how to make sure that the device you get is accurate, how the importance of accuracy and things you should be looking for, both as a consumer and as a company that's trying to make a wearable. So we have a lot of education, not just for our partners, which are commercial entities that make wearables, but also for the end users, such as consumers and also the media.
Well, thank you so much for joining me today, Dr. LeBoeuf.
Pleasure to speak with you, Cassie. Thanks for your time.
I want to thank you so much for listening today. If you love this podcast, please do share it with your friends and colleagues, and please leave a review on iTunes, Google Play, or Stitcher, because it makes a difference for circulation. For the show notes and other great info, enter your email into the mailing list at techleaderstoday.com. Thank you.